All right. People come to me all the time and they want to know the difference between testosterone injections, TRT, peptide therapy. Should I start peptides before I start testosterone? Should I do testosterone before I start peptides? Which one should I do? I don't know. That's kind of the thing I hear all the time. When people hear steroids, they usually think bodybuilding drugs. In reality, testosterone is a natural hormone that your body already makes, and TRT, or testosterone replacement therapy, simply gives you back what your body can't produce at an optimal level anymore. And there's lots of reasons for that. The food supply, the bioplastics, the pesticides, all this junk that they've been putting into our environment is crushing our natural testosterone rhythms. um, so what is testosterone injection? So it's a steroid. It's a prescription testosterone hormone that's nearly identical to what your body naturally produces. It can be done at a physiological level. Some people like it to have it a little super physiological, and um, but the goal is to normalize testosterone levels, you improve your energy, improve your mood, improve your strength and your libido. And it also helps with cognition. It helps with uh, sugar handling. It helps with all sorts of stuff. Like you got to get your testosterone right because that's your master metabolic handler. So most people do it as either testosterone cypionate or enanthate. They're just a different ester of testosterone. If your doctor's doing it every 2 weeks, you're doing it wrong. If your doctor's doing it once a week, it's probably better. Some people are actually microdosing this so that they get a more pulsatile uh, program. You can use testosterone in a cream. Uh, it can rub off on people, and it's not as efficient at keeping it at a high level because it does go up and down. There's other esters as well. There's testosterone propionate, which is more of a water soluble testosterone that works really well for those daily injections. I think that works way better. If you're going to be getting into this microdosing stuff, and we can have a whole nother discussion about this, but the testosterone cypionate and enanthate that people are doing microdosing, it really doesn't make a whole lot of sense because it's a long acting ester and it lasts in the system for quite some time. So if you're microdosing it, eventually you're just going to get to that level and it's just not going to do much different than if you just took it all at one time. Um, so that's what testosterone injections are. They're one of the most common and effective methods of delivery of TRT. There's some people that are doing orals. Now you see that on the internet a lot. They have a lot of side effects. They're tough on the liver. They can cause a lot of other unwanted side effects that you hear about with testosterone replacement. So I'm not a fan of it, but I know that a lot of people don't like to use needles, although I think that's changing a little bit. So TRT is an overall medical program designed to restore hormone levels to a healthy functional range, improve symptoms like low energy, low libido, low mood, increased motivation, muscle mass. Uh, you monitor safety markers. You got to monitor the hematocrit, which is a measure of how thick your blood gets. It can make some people have their blood get a little thick, and the answer is you just have to give blood every once in a while, which is probably a good thing anyway. You got to measure your PSA, which is your prostate antigens. You want to measure your estradiol, which is your estrogen, because testosterone actually converts to estrogen, guys. That's what actually makes you stronger. So you don't want to make your estrogen go to nothing. But if you have too much estrogen, it can make you look kind of puffy, and it can make you moody and all sorts of other stuff. So you don't want too much estrogen. You want to make it, like Goldilocks and the Three Bears. What's just right? You want to measure your lip. You want to look at your lipids and your liver, and just keep an eye on those things. So it can be delivered through injections. I think that's the most effective way. It's simple. Creams are another way. Pellets, I don't recommend pellets. I think they're not very controllable. I think I don't know. It's like it's just not a great way. So don't do it. It's not great. Oral formations, um, they're less common, but they're becoming more and more common because more and more people are starting to think they want to replace their testosterone. If they could do it with a pill, I'd rather do that. But I'm not a real fan of testosterone in a pill. It doesn't work great, it has more side effects, and it does affect the liver more. So when you think of testosterone injections, the best method, in my opinion, is injections. And I actually like a blend of testosterone. which is I they used to make one that was called Sustanon. It was great. It was 4 different blends. Now you can get the compounding pharmacist to make 3, and that includes like a propionate, an anthate, and a cypionate. So they come out at different times. So you get one that comes out right away, one that comes out a little later, and another one comes out later. And so it just stays nice and level throughout the week, which I think is, for most guys, that's kind of the best way of going about it. So peptides. Peptide therapy, peptides are signaling molecules that tell the body to do a specific job, like increase growth hormone release, like that's Samorelin, that's CJC, ipamorelin, things like that. Improve tissue healing, that's BPC, that's what we think about with TB500. Activate fat loss pathways, right? That's AOD or MOTS. Um, Testosterone, also, testosterone is also part of that growth hormone stuff. Improve sleep or cognitive function. So there's lots of things. There's also peptides that are going to help you with your energy, like your mitochondrial function. They don't replace hormones, guys. They just don't. So you gotta look at your hormones. Probably, it's always better, in my opinion. It's better to fix your hormones before you start just doing peptides. These peptides will now help your body modulate or optimize specific biological pathways and make them work better. So why do we fix hormones first? Your endocrine system is the master control system. Your hormones control the baseline functioning of your metabolism, your recovery, your energy, and your brain. So if your testosterone, your cortisol, your thyroid, and your DHEA, your pregnenolone are all off, fat loss becomes more difficult. Peptides work less effectively and efficiently. Your recovery is impaired. Inflammation is higher, your sleep is disrupted, your cell signaling doesn't respond optimally. And peptides, guys, they're amplifiers, but amplifiers only work well if the foundation is already built. That's your hormones. So you got to think about it that way. And I think it's like TRT sets the foundation, peptides build on top of that foundation. So if the base is cracked and unstable, peptides have limited benefit, and they can even produce really inconsistent results. So if you want consistent results, bottom line, testosterone injections, they're a form of TRT. They're not steroids in the bodybuilding sense. Um, TRT restores your natural baseline hormone function. And then peptides come in and fine tune or enhance specific systems like healing or growth or fat loss. But we always stabilize hormones first, because peptides work best when the core hormone system is balanced and strong.